In the Know, a radio program talking to the newsmakers in Ogle, Lee, DeKalb counties and beyond, keeping you in the know. Here's your host, Charles Van Horn.
Good morning and welcome to another edition of In the Know. Joining us, the Executive Director of the DeKalb County Community Mental Health Board, Deanna Kada. Good morning.
Good morning, Charles. Happy to be here.
Glad to have you here. A lot of government and county organizations especially, some of those organizations fly under the radar. If you're not directly affected or involved with that portion of county government, you may not know it exists or what it even does. And as part of the DeKalb County Community Mental Health Board, what exactly is it that you guys sort of oversee, first of all?
So you're exactly right. We often say we're one of the best kept secrets in the county. We are a form of county government, but we're semi-autonomous in the idea that we don't report directly to the county board. We have our own board. And what that board is directed to do is to collect a portion of property tax. Back in 1967, the taxpayers of DeKalb County voted to have a portion of their property tax set aside to fund in the areas of mental health, substance use disorder, and developmental disabilities. And so since 1967, the Mental Health Board, which is 9 people who are appointed by the county board chairperson, make decisions on an annual basis about where those funds should go, what kind of programs they should take care of, and how we make sure the people of DeKalb County have access to behavioral health care.
It is sort of a shift in American society, as I put on a little bit of a history hat here, especially in regards to mental health and substance use disorder and those with, again, with disabilities. It was sort of a dark time around the planet, really, in regards to caring for people with issues or issues from birth or things like that, where they were just sort of shoved away. And that was like the status quo. It was post-World War II. All of a sudden, people were a little more sympathetic, going, you know what? Integration in society is the better answer.
Absolutely.
And so that's really been the shift. And again, by 1967, it was like, we have to do something. The sanitariums are gone. Let's do something within the community and locally instead of just sending the relative off to who knows where. It's been turned into more of a community approach. And a lot of different counties have the similar thing that you guys do. When this started in 1967, I'm sure the funding outlays were much different than they are today.
Yes. You know, we have seen steady growth in DeKalb County of that property tax return, not necessarily because they're raising property taxes, but because there is more population, more industry, and those things bring about more property tax, which has us currently up to a budget where we grant out about $3.8 million a year.
Yeah. And a lot of agencies rely on that funding to keep themselves going, serving the people of DeKalb County, which is where you want the tax dollars to go, because it's the tax dollars of the people of DeKalb County, and you want to support those in the county who have needs. A lot of the organizations, you don't do a lot of hands-on actual care of people. You sort of, I guess, spearhead and prompt the local organizations and fund them to do good for the people in the county, right?
Absolutely. So we're not direct service, right? You're not going to come into our office and be able to make an appointment for a mental health assessment. We are funders at heart. So we want to make sure, once again, that access piece is what's so important, that if you have a need in DeKalb County, that you have access to get that need met. And so we fund organizations. Our mental health clinic in DeKalb County has been Gordon Center, which is a part of Northwestern Medicine. They receive the largest amount of funding from our grant making. And then we fund teeny tiny all-volunteer organizations like the DeKalb Area Lano Club, which is the area that hosts our meetings for NA, AA, Al-Anon, and we fund them to make sure they can keep their doors open so people can get to those meetings. And we fund everything in between. We fund lots of different abilities for people with developmental disabilities to access quality of life enhancers. So employment, recreation, healthcare. Those are the kinds of things that we want to make sure people have access to. And I'm going to be honest, we don't have that solved, right?
Yeah.
There are people out there who are going to be like, oh, Deanna, I live in DeKalb County. I can't get what I need. We're working on that. We want to hear from people so that we are making those strides to improve all the time.
It is a challenge, I'm sure, with that many agencies to carve up that pie. And sometimes in some years, probably tough decisions have to be made. Is there a need, you think, in the county right now that if you had a magic wand and you would be like, I would like to have unlimited funding for this, this project, whatever this agency is, I'm sure you probably have half a dozen of them. You'd be like, if they had unlimited funds, oh my goodness, the good they could do.
And that's just it. I mean, one of the biggest issues, and this isn't exciting to talk about, but it is the reality, is that people who have different insurances have different access, right?
Yeah.
So if you have private insurance, if you have Medicaid or Medicare, if you have MCO, you're going to have a different experience accessing services. There might not be a therapist who can bill your insurance. There might be a wait list because they only have so many slots. If I could wave that wand, everybody would get the type of service they need, when they need it, and how they need it. Do they want to see someone in person? Do they want to do telehealth or virtual visits? Do they want somebody to come in their home? Do you want to meet at McDonald's and have a cup of coffee? That would that would be the perfect way, is that people have access the way that they want it. But right now, because we complicate things, and mental health board are local dollars that blend with state dollars and federal dollars, we're always doing this push or pull to make sure we can cover at least the basics.
Deanna Kada, the executive director of the DeKalb County Mental Health Board, joining us this morning. The Mental Health Board, you said, is appointed by the county board chair. Now, the members on that board, are they from the public at large? Are they county board members? Is it a mix of just different professionals in different industries?
So the really interesting about mental health boards is we exist by statute. So there's statutory requirements that we have to follow. And one of them is at least one of our board members has to be a liaison with the county board. Okay. So we have one county board member, Lori Emmer currently, who is our liaison. And then everyone else on the board is from the general public. We try to have as much representation as we can. So DeKalb County is big, right? Yeah. We go from Kirkland all the way down to Sandwich. We try to have geographic representation. We want people who come in with lots of different knowledge about behavioral health care. So we have somebody who is a social worker that works up in Rockford. We have somebody who is a retired special education teacher.
Oh, great.
We have somebody who is an attorney who started drug court. Somebody else who runs a nonprofit that works with people with HIV and AIDS diagnoses. And we want all those different perspectives to come in because, as you said earlier, making decisions about funding is the hardest thing we do, right? There is more need than we have dollars to fund. So the more expertise we have on the board, the better those decisions can be made. And we can talk about why they're made that way. And so we're really proud of the representation we have.
The staff in your office, how many people are employed?
So there's two of us.
Yeah, that's like I figured. That's funny because I know there are people probably listening right now going, oh, well, this is just an infrastructure thing, and they probably have 12 people in their office just shuffling papers around. No, a lot of times these organizations are very small and overworked and in a cramped space, and sometimes the county doesn't give you the resources you need. Do you actually have the ability to stand up and swing a bag over your head in your office, or are you in a very cramped space?
So actually, we are in a really lovely space.
That's good.
We're out in the middle of nowhere, which is fine, right? Yeah. We're not public facing, so we don't have people visiting us. But we do have the space that we need. There are two people, myself and my administrative assistant, Heaven Allen. And the truth is we do produce a lot out of there, but it's because we're really passionate about what we do. And we know that what we do is important. So it's not, I think sometimes people get this vision of government workers kind of sitting around, looking at the clock every day. That's not what we're doing. We do this because we care about people getting their needs met. And so that's what we're in there doing. And I wanted to kind of share that the Mental Health Board, we're not just funders. One of the most important things we do is we want to get in the community and get people talking about mental health and mental health care, because we want people to have prevention early on and not end up at that far end of the scale unless they really need it. If you have a chronic mental illness, we want to make sure there's services to protect you. But if we can keep you mentally well, then, we're doing our jobs even better. So normalizing conversations about mental health is critical to the work we do.
Mental health, help with those with disabilities, and substance use disorders, three of the things that the Mental Health Board helps tackle. These agencies that you said, there are a couple of big ones, the ones you have, plus these smaller ones. If somebody has an agency that's a nonprofit in DeKalb County, I mean, odds are that you probably are aware of them. But if not, if they want to get involved with you, is there a presentation? They have to say, hey, listen, we're sort of doing this now. Maybe could there be funding in the future, or what advice can you give? Are you guys open to those types of conversations?
Absolutely. We always want new organizations to come talk to us so that we can see how it all fits together. And so we do have a pretty good website where people can contact me by email or call the office. And we can do a really informal. We are pretty informal. We're relationship based, right? We want to learn what people are doing and how we can help, because sometimes if we don't have funding, we can help in other ways. One of the other big things we do is professional development. So we want to make sure our professionals have access to continuing education. So if you're a new nonprofit and you need some training, we want to help you find that and provide that for you. We want to get you on our list for other funding opportunities. So we have our annual funding, but we also have other grant programs. The Mental Health Board, for the first time last year, we were voted by the county board to manage the opioid settlement funds for DeKalb County.
And that was quite a bit.
It is. It's about $400,000 for this year, and we just finished our grant program for that. So getting ready to announce those grants, that was a big deal. We also started a grant program for really brand new organizations like you're talking about. You know, people who are in the communities, helping people in the communities that they live in, doing grassroots behavioral health care work. We started a program to build some capacity for those organizations so that they can grow and they can fill some of those gaps that we're seeing.
The gaps are everywhere when it comes to mental health. I mean, we see it especially with the interactions with courts and law enforcement. And I talked about the big shift post-war about getting folks with needs back into the community. One thing that hasn't really been shifting well has been just calling the police on somebody in crisis. And that is certainly something that needs to be bridged. What steps are your organization doing with your partners to sort of make sure that it's modern day, I suppose, mental health work and screening and assistance, as opposed to the old method of just, that's Bob and just call the cops again?
So there's a lot of work being done statewide on that issue. There was a law passed. I'm never going to remember what the whole name is, but it was called CESA. It's not implemented yet, but always looking at a July 1st date for implementation of that. So we've been working on this for about 5 years. Yeah. And so we meet monthly with our regional partners to talk about how to implement these changes. And when we talk about changes, it means maybe having people not call 911 if it's purely behavioral health care, if there's no danger to anybody, but somebody's just weird, just acting kind of off, call 988. And 988 is a number that can help somebody who's in distress or help somebody who sees somebody in distress come up with an alternative report, right? That maybe you're sending out a behavioral health care professional, a therapist, a peer support specialist, which is like one of the most amazing things that I think our field has done, is to recognize that people with mental health or substance use issues can help other people with those. So we're really kind of at the forefront of making sure we're a good partner with that. We also have a local DeKalb County group that we meet quarterly to talk about. Sometimes we do just talk about Bob, right? Yeah. Because everybody knows Bob. We do it with confidentiality. We always make sure that we're following the rules. But if there's ways we can help Bob that don't involve a law enforcement response, that's what we want to look for.
And just to clarify, Bob is just a made-up name, by the way. We're not targeting anyone individually.
Nope. If you're Bob, we're not talking about you. This is made up. But I will say that that we want to make sure that we're having kind of all those responses. But if there is an emergency, if someone is in danger of harming themselves, someone else, 911
Absolutely.
is the number always to call, because safety is always the most important thing. And we're talking safety for our residents, for our people in distress, and also for our first responders.
One last topic to touch on, just real briefly. Those without homes ties into what you guys deal with, I'm sure.
Yes. Absolutely.
And the funding for that also is pretty scarce. And again, we talk about that magic wand. If there's a way to get more funding for you guys, how can the general public go about making sure you get the finances you need? So the hard thing with us is 100% of our finances come from property taxes. And when you talk property taxes in Illinois, that's a hard topic. Yeah. Because we pay a lot. I live in the community I work in. I know what the property taxes are. I know they're high. But the fact is, we're getting a lot for those dollars.
mental health boards do not exist throughout the state. It has to be voted in by referendum. So if you have one, you already have something that other places don't have. And so it's understanding. I guess I would, with my magic wand, want people to understand what property taxes give them, and that they realize that they're getting more than just, a raise for those of us who work in government. Chances are we're not getting the raises. What we're getting is more dollars to make sure that you and your neighbors and your parents and your kids and the people you love and care about have access to the things they need in the way they need them.
Supporting the community, the DeKalb County Community Mental Health Board. Deanna Kada with us this morning, Executive Director. Thank you so much for joining us today.
Thanks. It was a pleasure to be here.
Thank you for listening to this week's In the Know. The program returns next week at this time with another great conversation with someone from your community.